Hello, today I'll be presenting my case from my fieldwork assignment. We're going to call my client Monica. So Monica is a 34-year-old female. She lives with her mother in a two-story home. As far as her work, she used to be a third-grade teacher. She was referred to OT for her pain, hypersensitivity, numbness, and weakness in her fingertips, which were preventing her from engaging in her occupations. So she's unable to use her hands for various activities like dressing and meal prep. She has trouble holding particular textures like certain foods. She has trouble, like for example, like hard tortillas, she can't hold that, or towels, since they have different textures, and so certain towels she cannot hold. She has trouble writing, so she has trouble holding pens and pencils. One of her goals in OT is she wants to be able to use utensils again to eat. So she, especially particularly, she wants to be able to use chopsticks again. So the setting that OT is delivered is at an outpatient hand therapy clinic. So hand therapy is a specialty practice area of OT that's concerned with treating orthopedic-based conditions. So OTs in this setting, they use an occupation-based and client-centered approach that identifies the participation needs of the client. And the primary goal of therapy is the performance of desired activities. And Monica was referred to hand therapy due to the pain and hypersensitivity in her hands, which was inhibiting her from fully participating in occupations such as meal prep, feeding, and home management. The occupation-based model that I decided to view Monica through was the PEO model. So for example, we're going to use one PEO misfit. So the person factor in this PEO misfit is Monica's pain and hypersensitivity in her hands. The environment factor is the various textures of foods and utensils. And the environment factor is, the occupation factor is Monica feeding herself and preparing meals. So in our PEO misfit, the PO is Monica has difficulties preparing meals and feeding herself due to the pain and sensitivity in her hands. The PE is Monica has pain and hypersensitivity in her hands when holding foods and utensils of various textures. And the EO factor is that foods of different textures inhibit Monica from feeding herself and preparing meals. So the PEO model emphasizes occupational performance shaped by the interaction between person, environment, and occupation. And so in order to maximize Monica's occupational performance, the misfits between her PE and O factors have to be addressed. So referring to my previous example, if Monica's P factors are addressed, her pain and hypersensitivity in her hands don't inhibit her from her feeding and meal prep occupation. And if Monica's E factors are addressed, the foods and utensils of different textures that she uses does not stop her from participating in feeding and meal prep. And if Monica's O factors are addressed, she'll be able to adapt the way that she performs her occupations to maximize occupational performance. So some of an overview of Monica's occupational issues is that, as mentioned, she has difficulty cutting and using utensils during meal prep and feeding. She has trouble with the textures of certain foods as well. She has difficulty with grooming and lower extremity dressing. And she has difficulty performing home management tasks such as laundry and making her bed in the morning. So one of the assessments that we did was, of course, an occupational profile. Another one was the modified fatigue impact scale. And the results for that was she got a 54.76 out of 84, showing that she does have some fatigue. We also did a timed up and go test, and the results were 17 seconds, which puts her at a fall risk. And we also had her fill out a functional tasks recording form. So in this form, she prioritized the ADLs and functional tasks that she wanted to do, and we had her rate it from a scale of 1 being she has no difficulty performing this to 7 um, that she's not able to perform this activity. So she prioritized dressing, styling hair, writing, picking things up, carrying opening beverages, preparing meal, carrying pots and pans, laundry, and making bed, and moving faster. Um, we also assessed her ADLs and her IADLs. So for bathing, she stands and leans and manages herself. For dressing, she manages herself for upper extremity dressing, but she needs help for lower body dressing. For driving and traveling, she's unable to perform driving. She needs maximum assistance when she's traveling. For meal prep and self-feeding, she's also at max assist because she has difficulty in cutting and using utensils because they feel heavy, and she's unable to perform home management tasks. Monica's short-term goals we will be educating her on fall prevention and energy conservation techniques. We'll also be one of our other short-term goals is for her to be able to perform home management activities. One of her long-term goals will be that she'll be able to perform lower body dressing with modified independence in 4 weeks, and that she'll be able to perform meal prep and feed herself with modified independence in 4 weeks. So this treatment session that I'm about to outline for you guys took place 2 weeks after Monica's initial evaluation. So in the first 10 minutes of the session, we gave her a fall prevention handout, and she was educated on energy conservation techniques such as taking rest breaks during prolonged tasks and using a shower bench when taking a shower. For 15 minutes, we, after squeezing some soft sponges as a warm-up activity, we practiced folding laundry towels and making the bed. And in order to do this, we gave her a pair of gloves to help her fold the laundry with, to ease her hypersensitivity sensations on her hands, since she's unable to perform that activity at her current level of functioning. Using gloves helped her to compensate for her hypersensitivity. For 20 minutes, we practiced using a reacher to aid with lower body dressing by pulling her pants up to her knees while in a seated position, and completed task after standing. And then for 15 minutes, we practiced using chopsticks with the soft sponges. She practiced picking them up and putting them into a container. And then we practiced using modified utensils as pictured, with sponge tube covering to aid with self-feeding. So as she's using a fork to eat, she can touch the soft surface of this sponge tube covering, which will compensate for the hypersensitivity in her hands, preventing her from eating where she is at currently. And these can also be used on other things as well, such as like a comb or a writing utensil. So for discharge, we want to refer her to a neurologist for her peripheral neuropathy, and refer her to physical therapy for balance and lower extremity strengthening. We're going to recommend environmental and home modification like soft grippers on doorknobs, and a moleskin adhesive tape for pens and pencils. We had some at the therapy room, so we gave some to her to take home to wrap around her pens and pencils so that she could use them at home. And this is one of my references that I used. Thank you.